Now, to help explain these disability services and supports, I want to introduce you to Alison Sabrana. Next slide. So Alison is a disability activist living in Fort Collins, Colorado. She has ME, POTS, and related conditions after contracting a virus almost 10 years ago. I've loved working with Alison, and I can tell you she is passionate about helping chronically ill and disabled people understand their rights and navigate barriers accessing care and services available to support them. Alison's passion for this is personal. She struggled to access care and services to support her daily life as a disabled Coloradan, but it's also a core aspect of her professional work as a former community health manager for Colorado's Medicaid program. Alison, I'll turn it over to you now.
Thanks, Ben. Okay, getting myself set up here. Okay, I am so excited to be here today to talk to you about this program. If there's anything you take away from today's presentation, I want you to understand just how much getting disability services and supports has changed my own life living with ME in a good way. I helped advise on Canary Corps because our community deserves to have the same access to service and supports that I've had. We all deserve to have our needs met. So like Ben said, I'll talk you through a little bit of history and context about these services and supports, and that Canary Corps will bridge our community to, including some examples of how these services have helped people with ME. So in 2016, my chronic illnesses worsened significantly due to lack of access to informed care and lack of access to support services. And that had a daily impact on my general survival, but also my finances. I had to go against medical advice to stop, rest, and pace, and I pushed myself to continue working until my body literally could not continue another day. It took me many years, I estimate about 8.5 years, to get access to all the supports and services I have now that made any chance of financial stability and medical stability possible. Even today, my ability to manage my medical condition, ME, POTS, and related diseases, is deeply intertwined with my financial survival. And I know I'm not alone in that. In 2022, last year, I spent $13,421.40, an amount equal to an entire year's worth of income at 100% federal poverty level on medical expenses alone. So that used up all of my SSDI payments for the entire year just on medical expenses. And during that time, I was dually covered by Medicare and Medicaid. So this was all expenses outside of insurance when I had all of my premiums, copays, and deductibles paid for. This is the lowest that my expenses could have been. So depending on the day, I may or may not look disabled to some people, but I know that my fluctuating dynamic disability, which people with ME and related conditions often experience, is still a disability, and I absolutely deserve disability services and supports just like everyone in our community. I share this because this is not a unique experience. We know it's so common across our community, but it's something that I struggled with even though I worked professionally in the system. I didn't access services and supports that I needed for too long because I didn't think I would qualify because of my dynamic disability. I also want to point out that I acknowledge that chronic illness and disability exacerbate and intersect with existing social inequities and other forms of discrimination that I haven't experienced. Okay, so I want to talk a little bit about my background, having worked as a community health care manager here in Colorado for a Medicaid program. Backing up just one step, Medicaid is a federal and state health insurance program. It's operated by individual states, and it provides coverage to millions of Americans. It's also the primary payer across the nation for long-term care services. And Medicaid covers children, adults, seniors, and people with disabilities. So I was working for this program here in Colorado. And as my disability progressed, as my ME got worse, because I kept pushing myself to continue working. It was literally my job to help people apply for programs and access appropriate care. And yet I struggled with that after I was done working to meet my own needs, even though it was my job to do that for other people. After I couldn't continue working as a care manager, I even worked in the office in my county that processed Medicaid waivers, and my employer saw up close my decline with ME, that I couldn't even sustain part-time work in a power-assisted wheelchair, and they still didn't think that I would qualify for home and community-based services because they were fundamentally misinformed about how dynamic disability presents. So all that being said, this is hard stuff, but I really do want to communicate that in all my years of living with these infection-triggered chronic illnesses, there is one thing that has made the biggest difference in my quality of life so far. That one thing is disability supports and services that I receive. That's why I'm so passionate about making sure that our community can access them. Accessing these services make it possible for me to use my limited energy living with ME to build a fulfilling life out of a new normal, living with chronic illness and disability and participating in my community, even with my limitations. This is what informed my work on Canary Corps, and like I said, why it's so important to me that our community be able to access these services. So like I said, many of us know how hard it is to get access to the support and services we need. It's not for lack of trying, that's for sure. So we face a lot of systemic barriers when we try to get our needs met. This looks like complicated eligibility criteria. It looks like long and complicated application forms or recertification forms in order to keep staying on your benefits once you access them. It looks like inaccessible information about the assistance programs or about the offices where we might be able to apply for them. It's lengthy wait times for appointments or for evaluations that are required in order to get access to programs. And it's also stigma or attitude of the workers who process applications or the professionals who need to sign off on them. For example, like when a doctor won't sign off on a handicap placard application or anything similar to that. The other thing that makes it hard, combining with those systemic barriers, is the nature of our disease. It makes it almost impossible to get the support that we need. It would be hard for a non-disabled person to navigate these systems because of how complex they are, but it's especially hard for people with energy-limiting chronic illnesses like ours. We often don't have the energy to get through the bare necessities of our day, let alone navigate complex paperwork, systems, and assistance programs. The nature of our disability makes jumping through all of these hoops seem just as doable as climbing Mount Everest for us, pretty much impossible.